the former chief scientist, said, "What I do think was backwards and not helpful was that the White House made an announcement with a certain date before really all the data had come in, before FDA had had a chance to review it, and before there was this public discussion that we're now going to have." So what do you make of this?
I think that's right. I mean, look, I think it's very clear that the White House came out and they said boosters, put a date on it, September 20th, and I think most people sort of heard that and thought this was preordained. This was happening for everybody. They were going to be able to get boosters if they were a certain time period out from their shots. And they did say during those announcements that we're going to wait for the FDA and CDC to weigh in on this, but it was clearly getting ahead of things. You heard them say, look, we were just doing this to be prepared. I think it's quite possible that you can be prepared without also telling the American people that on September 20th this is happening. We're going to wait for the scientific agencies to weigh in, but this is happening. So I think it confused a lot of people, including, Dr. Paul Offit, who you've interviewed many times, Jake. He's also on the advisory committee, which, by the way, is a committee. The FDA almost always takes the advice of the committee, but not always. So that's something to look out for as well. But listen to how Dr. Offit put it.
We're being asked to approve this as a 3-dose vaccine for people 16 years of age and older without any clear evidence of the third dose for a younger person when compared to an elderly person is of value. If it's not of value, then the risks may outweigh the benefits.
So what he was basically saying is that the original vote was on people over the age of 16, and it was an approval to boost, to allow boosters in that general population. That vote went down. The second vote was an authorization, not an approval. So this is now an emergency use authorization to go ahead and allow boosters, as you heard from Phil, for people over the age of 65 or people who are at severe risk of severe COVID. So it changed. Authorization and a very specific now group of people.
And there was really no disagreement that people over 65 or people with compromised immune systems should get boosters, right? I mean, that wasn't the issue. The issue was the Biden administration came out and said everybody's going to get boosters, and FDA scientists were saying, and in fact, there were resignations. The science isn't there. What are you talking about?
Yeah, it's interesting. The science isn't clear cut still. I think that you can make a much stronger case for people over the age of 65. But if you look at in hospitals overall, and you say, okay, out of 100 people in a hospital, 95 of those with COVID are unvaccinated. 5 are vaccinated. Those are the breakthrough infections, severe breakthrough infections. Now, who are those 5? Well, they tend to be older, people who are 65 and older and have, some pre-existing conditions. So, yeah, it makes sense to have them get the boost. But in terms of the context of the country, Jake, the vast majority, 95%, are still the unvaccinated that are in the hospitals. So will this make a difference for those who already have some degree of protection? Yes, but that's a very small percentage of what's actually causing these dramatic surges in hospitals right now.